At 2:47 in the morning, while a patient in bed 7 was coding and the crash cart was still 3 hallways away, my supervisor called to tell me my retention bonus was going to be $5,200. She said it with the same voice people use when they think they're doing you a favor. I didn't hang up. I just set the phone face down on the nurse's station counter and went to save the man's life. I'm a registered nurse. Have been for 19 years. My name is Miles Carver. I'm 51 years old, and until 8 months ago, I worked the overnight shift at Hargrove Regional Medical Center in Columbus, Ohio. 12-hour nights, 3 to 4 shifts a week, for nearly 2 decades. I've seen things in that hospital between the hours of 11 p.m. and 7 a.m. that would make the day staff's hair go white. Not because days are easy. They're not. But because when the sun goes down and the administrators go home and the visitor count drops to 0, the hospital stops performing for an audience. It becomes what it actually is. I know that place the way you know a house you've lived in so long you can navigate it blind. Every equipment quirk. Every physician will actually answer their pager. Every patient who says they're fine but isn't. The night shift is where you learn which shortcuts save lives and which ones end careers. I knew all of them. It started the way a lot of bad things start in healthcare, with a meeting that got scheduled with 12 hours notice. The director of nursing at our hospital was a woman I'll call my director. Efficient, politically sharp, the kind of administrator who learned early that the safest position in a bureaucracy is always in the middle, not close enough to the bedside to get blamed for bad outcomes, not far enough from leadership to miss the good news. She called a brief all-staff meeting on a Wednesday morning, which meant nights had to come in on their off hours or watch the recording later. I watched the recording later. I watched the recording. She talked about reinvestment in staff, talked about recognizing our most essential contributors, talked about retention bonuses for critical personnel. I'd heard language like that before, and I knew what it meant. Some people were getting something, and the framing was designed to make everyone who wasn't getting as much feel like they should still be grateful. There was a nurse on day shift. I'll call my colleague, 32 years old, 3 years at Hargrove, very good at her job in ways that were visible. She presented well in family meetings. She communicated warmly with attending physicians. She always looked composed, even at hour 11 of a 12-hour shift, which is a skill in itself. Leadership loved her. She was a kind of nurse they put on the recruitment brochures. I didn't dislike her. That's important to say. What happened wasn't about her. She was good at what she did. She just did it in the light, where people could see it. 2 days after the all-staff meeting, my charge nurse pulled me aside at the start of my shift and said the retention numbers had been sent out. She said hers with a flat voice that told me everything I needed to know before I even checked my email. My colleague on days got $26,000, cash with an 18-month agreement. My charge nurse, who had worked nights for 11 years and could run a code blue better than most attending physicians, got $7,000. I got $5,200. I sat with that for a minute. Then I went to work, because that's what you do on nights. There's no time to sit with things. The call from my director came 3 nights later, during what turned out to be a rough shift. She led with the same warm-up people always use before they explain why you're not worth what you thought. You're indispensable, Miles, the backbone of our night coverage. I've told leadership how much you contribute. I nodded into the phone. I'd been nodding into phones like that for a long time. $5,200, she said. And she said it in a tone that expected acknowledgement, like she was waiting for me to tell her it was more than I'd hoped. It was roughly the cost of 4 months of my daughter's college tuition. My daughter was a junior at Ohio State studying public health. I'd been supplementing her expenses since my wife and I split 6 years ago. Not dramatically, not bitterly, just the quiet math of one income doing what used to be 2 incomes work. I had the spreadsheet to prove it. I thanked my director and ended the call and set the phone down, and the charge nurse looked at me, and I looked at her, and neither of us said anything for a long time. She finally said, "Same." 5-2, I said. Same. 5-2, I said. She made a sound that wasn't quite a laugh. Later that night, I opened a notes app on my phone and did what I always do when something bothers me in a way I can't yet explain. I typed the two numbers, $26,000, $5,200, $26,000, $5,200. Then I sat there looking at them until my pager went off. The real problem wasn't the number. The real problem was what the number said about 19 years of working nights. About every Christmas Eve I'd spent monitoring a sepsis patient while the day staff was home with their families. About every time a family called at 3 in the morning terrified and I was the voice that talked them through it. About every protocol I'd revised and every new hire I'd mentored and every situation I'd quietly handled that never made it into any performance review because it happened in the dark. Day shift got the documentation. Night shift got the problems. There's a particular kind of tired that comes from being essential in ways that are never officially recorded. I'd been carrying it so long I'd stopped noticing the weight. The Monday after the bonuses went out, our floor had a situation, not unusual for nights. 2 patients in simultaneous distress, one of them a 68-year-old man, 3 days post-cardiac surgery, whose vitals started dropping around 1 in the morning in a pattern I'd seen before. Quiet at first, the kind of deterioration that looks like nothing until it's everything. I caught it, got the on-call cardiologist on the phone, walked him through the numbers, advocated hard for a specific intervention he was initially reluctant to order. He ordered it. The patient stabilized. By 6 a.m. when day shift came in, it looked like a routine night. Nobody asked what it had taken to make it routine. There was a nurse on days, the young one, the one in the brochures, who got credit in morning rounds for the patient's stable status because she was the one who inherited the chart. Not maliciously. She just reported what she saw. Patient stable. Intervention implemented overnight. Nobody asked who'd fought for that intervention at 1 in the morning. This was the pattern. I'd been working inside it for so long I'd accepted it as weather. 3 weeks after the bonus announcement, I was offered the retention agreement to sign. I read the whole thing. Most people don't. There were clauses about workload expectations, on-call availability, scope of responsibilities. The language was careful. What it said plainly was, we want to hold on to you for 18 months, and in exchange, you're agreeing to continue doing everything you've been doing, regardless of staffing levels, regardless of patient census, regardless of any changes in how we structure the floor. For my colleague on days, that meant 18 months of day shift hours, manageable caseloads, a supervisor on site, and support staff available for backup. For me, it meant 18 months of nights, skeleton crew, physicians asleep, 1 charge nurse and sometimes 2 other RNs covering a floor that, on a bad night, could run 30-plus patients. For the difference of $20,800. I didn't sign it. I put it in a folder and set the folder on my desk at home, and I went back to work. There was a new nurse on the floor I want to mention. A kid barely 2 years out of nursing school. Sharp. Good instincts. He used to follow me around on slow nights asking questions, and I answered every single one, because that's how nights work. You teach because one day it's going to be 3 in the morning, and you're going to need someone next to you who actually knows what they're doing. I taught him how to read a deteriorating rhythm before the monitor alarm. I taught him which attending would actually come in versus which would give phone orders and hope for the best. I taught him the EHR workaround for when the system timed out mid-documentation, a thing that happened at least twice a week, always at the worst possible moment. I'd flagged it to IT 4 times. They kept closing the ticket as resolved. None of that was in my job description. None of it showed up in my performance metrics. My last 2 annual reviews said, meets expectations in every category. Not because my director thought I was average, because the formal review scale was designed for day shift benchmarks, and half of what I did didn't have a checkbox. The night that changed things happened on a Thursday. The situation started small the way they always do. 2 patients with elevated concerns, nothing critical, the kind of monitoring situation where you're watching without being alarmed. By midnight, one of them had escalated. By 1 in the morning, we were managing 2 simultaneous crises with a team of 3 nurses on a floor that should have had 5. I called the supervisor on call, a woman who covered administrative overnight from home, and told her we were understaffed for the situation developing. She said she'd look into backup options. Backup options on nights means calling in people from their off hours, which means 30 minutes minimum before anyone arrives, which might as well be never when you're in the middle of something. I told her plainly, we need a decision on escalation protocol right now, not in 30 minutes. She said, use your best judgment, Miles. You always handle these things. And there it was. The exact sentence I'd been hearing in different forms for 19 years. You always handle these things. Not, here is the support we're sending you. Not, here is what the protocol says. Just, you always figure it out, so go figure it out, and we'll all be grateful in the morning when we don't have to deal with the consequences. I looked at the retention agreement, still unsigned in my bag. I looked at the staffing board. I looked at the young nurse standing beside me, waiting for direction. Eyes steady, good under pressure. Everything I'd spent 2 years teaching him condensed into that one look. I spent the next 4 hours doing what needed to be done. I documented every call I made, every decision, every timestamp. I followed protocol precisely. When things were stable enough to hand off safely, I wrote a full incident summary, not the abbreviated version, the real one, and I sent it to the director of nursing, the chief nursing officer, and the patient safety coordinator, all at once. 7 a.m. I did not sign the retention agreement. My director called me that same afternoon. I let it go to voicemail. The message was carefully worded. She hoped I was doing okay after a hard night. She wanted to connect. Nothing about the incident summary. I called her back 2 days later, on my terms. Rested, clear-headed, she opened with concern. Asked how I was holding up. I said I was fine. I said I wanted to talk about the gap between what my retention offer reflected and what the role actually required at night. She said she understood my frustration. She said budget decisions were made at a level above her. She said I was one of the most valued members of the night team. I said, I'm not frustrated. I'm clear. I've been doing this for 19 years, and what the agreement asks for is not proportional to what the agreement offers. I'm not signing it as written. Silence. The kind of silence where someone's recalibrating. She said we could revisit the numbers. She said there might be flexibility. I said I appreciated that, and I'd be happy to have that conversation formally, with HR present, and with a written description of what the night shift role actually requires, versus how it's currently classified. Until then, I wasn't available for anything outside my scheduled shifts. The week after that conversation, my incident summary started moving through the organization in ways I could track indirectly. Emails that CC'd people I'd never been CC'd with before. A calendar block that showed up on the Patient Safety Committee's schedule titled Overnight Coverage Review. A question from the CNO's assistant about whether I'd be available for a brief call. I was available. The review started quiet and got loud. Patient safety committees have a way of pulling threads until something unravels, and what started as a look at one overnight incident became a look at overnight staffing patterns, which became a look at how retention decisions had been made, which became a look at why night shift performance reviews were systematically capped at meets expectations regardless of measurable outcomes. Someone pulled incident reports from the last 2 years. The pattern was not subtle. Critical overnight interventions, most of them undocumented as individual achievements, traced back to a small set of night shift nurses who'd been rated as equivalent to staff with a fraction of their experience and responsibility. Someone else pulled the retention bonus documentation. There were no objective criteria attached to the amounts. It was discretionary, and the discretionary, it turned out, had been heavily influenced by who attended the morning leadership briefings and who gave polished updates in physician rounds, both of which happened during day shift hours. My director went on leave 6 weeks after the review began. Officially, it was personal. Nobody sent a farewell email. After 8 years, she was just gone from the directory. The administrative supervisor who told me to use my best judgment at 1 in the morning submitted a voluntary reassignment request. She moved to a different department, one without overnight coverage responsibility. The bonus program was suspended pending a policy review. The review was run by an outside HR consultant. The report that came back was not kind to the prior administration. None of this was loud. None of it was dramatic. It just happened, piece by piece, because the documentation existed and the questions finally got asked. I hadn't done anything except keep records and stop pretending that silence was the same as agreement. Through all of it, I kept going to work. I kept doing the job. The young nurse I'd been mentoring knocked on my car window one morning after a shift, right before I pulled out of the parking garage. He looked a little shaken, the way people look when they've just realized something true that they can't unrealize. "Did you know that was going to happen?" he asked. "I knew something was going to happen when people looked at the records," I said. "That's why I kept records." He nodded slowly. "They're going to reclassify the night shift role," he said. I heard it in the briefing. I told him that was good. I told him that was the point. 2 months into the review, I got a call from a recruiter I'd spoken to briefly at a conference 3 years earlier. Large academic medical center in Indianapolis. They were building out their night shift infrastructure, specifically because they'd had turnover problems and wanted to figure out what it actually took to run nights well. Day shift hours were available too, if I wanted them. Competitive base, better benefits, a staffing model that had been designed with input from the nurses who actually worked it. The hiring conversation was unlike any I'd had in years. They'd done homework. They knew my background, knew about Hargrove, knew the general shape of what had happened without knowing the specifics. They weren't looking for someone to fill a slot. They were looking for someone to help build something. The offer came back with a $22,000 base increase, real benefits, the kind where the deductibles don't make you choose between your health and your mortgage. No retention agreement, just a contract that said plainly, "Here is the work, here is what we'll pay you to do it." I accepted on a Thursday. I submitted my resignation at Hargrove on Friday. Standard notice, clean and professional. 2 weeks. I handed over every protocol I'd built, every training document, every note. Complete, nothing missing. That mattered to me. Not for them. For me. HR processed it within 24 hours, which told me everything about how badly they wanted to close the loop on my departure without any additional documentation entering the record. The young nurse texted me the night before my last shift. He said the floor was going to be different without me, and he said it simply, without decoration, the way people say things they mean. I told him he already knew everything he needed to know. I told him to keep documenting and keep asking why. My colleague from day shift, the one in the brochures, the one who got the $26,000, reached out too. I want to be clear about this. She was kind. She said she hadn't known the disparity until the review surfaced it. She said she would have said something if she had. I believed her. The problem was never her. The problem was a system that made visibility and proximity to leadership the primary criteria for reward, and she happened to fit that profile better than I did, through no fault of her own. She's still there. Last I heard, she was leading a process improvement initiative. Good, she's capable of it. I hope it makes things better for the people working nights. As for me, the first month at the new hospital was the strangest kind of adjustment. Not because the work was harder or easier, but because things worked the way they were supposed to. If you flagged a staffing concern, someone addressed it. If you caught something on a patient the attending had missed, they said thank you in rounds instead of looking at you like you'd overstepped. The EHR system had a help desk that actually responded. Small things. The kind of things that feel enormous when you haven't had them in 19 years. My daughter came to visit me in the new city for a long weekend in October. She's studying public health, which means she understands hospital systems in a way that makes her a better critic of them than most people I work with. We went out for dinner, and somewhere in the middle of it she looked at me across the table and said, "You look different." I asked her what she meant. She thought about it for a second. "Less braced," she said, "like you're not waiting for something to go wrong." I didn't have a response to that right away. I just sat with it. the way you sit with something true. She was right. For 19 years I'd been braced, ready for the next crisis, the next shortfall, the next night when we were one nurse short and I was the one who figured it out. I'd become so adapted to working in conditions that required constant vigilance that I'd stopped noticing it felt that way. It had just become what work felt like. Now when my phone rings after midnight, it's usually her, studying late or wanting to talk through something for a paper, or sometimes just calling because she knows I'm awake and we can talk. I always answer. 19 years I spent working in a building that needed me more than it admitted. I told myself it was just how things worked, that the recognition would come eventually, that doing good work was its own reward. Maybe it is, but good work and fair compensation are not the same thing, and I spent a long time confusing the two. $5,200 to stay in a role that held together an entire floor every night. I don't think the people who made that decision were cruel. I think they just never had to be in that building at 3 in the morning, so they didn't understand what it cost to keep it standing. I understand it. I lived it for 19 years. And when I finally stopped volunteering to be underestimated, the strangest thing happened. The systems I'd been holding up didn't rise to meet the challenge. They buckled, slowly and visibly, in ways that had nothing to do with me anymore. That's not revenge. That's just what happens when the truth stops being managed and starts being documented. I sleep through the night now. Not because nothing goes wrong at the new hospital. Things go wrong. They always do. But when something goes wrong at 2 in the morning, there's a process, there's backup, there's a chain of people who are actually reachable and actually responsible. I am one part of a system that functions, not the single load-bearing wall holding up a structure that was never designed to stand. My daughter asked me once what I wished I'd done differently. I told her, I wish I'd started keeping better records sooner, not to build a case, just to have an honest picture of what I was actually doing, because when you're in the middle of it, it's easy to convince yourself that the work speaks for itself. It doesn't. Work doesn't speak. People speak. Documents speak. Timings speak. The work is silent. You have to give it a voice. I've thought about what actually happened in that hospital a lot since I left. Not obsessively, just the way you turn something over when you're trying to understand it honestly, rather than just feel good about how it ended. What I keep coming back to is this. The system at Hargrove wasn't broken. It was working exactly as designed. It rewarded visibility. It rewarded proximity to the people who made decisions. It rewarded the ability to show up during business hours and speak confidently in rooms where the right people were watching. None of those things are wrong in themselves. The problem was that the system had quietly decided those qualities were worth more than 19 years of keeping a floor alive in the dark, and it had never bothered to say that out loud until the bonus numbers landed in people's inboxes. I don't think my director was a bad person. I don't think my colleague was either. People operate inside structures, and the structure told them both in different ways that what I did at 2 in the morning was background noise. Expected. Priced in. They believed the structure because the structure had never been seriously questioned. What changed wasn't that I confronted anyone. I didn't. What changed was that I stopped managing the gap between what the work required and what the role officially acknowledged. I stopped filling in the silence with extra effort and started filling it with documentation instead. I sent the incident summary to every person who needed to see it. I declined to sign an agreement that described my role inaccurately. I told my director plainly what I needed for the conversation to move forward. Those aren't dramatic acts, but they were honest ones. And honesty, when it's precise and persistent, has a way of making systems account for themselves. The young nurse I'd spent 2 years teaching asked me if I'd known what was going to happen. I told him I just knew that records don't lie the way memories do. I knew that if someone ever looked at the actual data, incident timestamps, intervention outcomes, staffing ratios, bonus criteria, the picture would be clear. I didn't manufacture that picture. I just stopped helping it stay blurry. That's the thing about integrity that nobody tells you when you're starting out. It's not a single dramatic moment. It's a practice. It's choosing, over and over to document what actually happened instead of what's convenient. It's choosing to say clearly what you need instead of waiting to be offered it. It's choosing to leave a place cleanly when the structure refuses to account for what you've given it. Not out of anger, but out of a clear-eyed understanding that your standards don't have to shrink just because someone else's did. My daughter said I looked less braced when she visited me in Indianapolis. Less like I was waiting for something to go wrong. She was right, and I think the reason is simple. I stopped carrying responsibility for outcomes that weren't mine to carry. I had spent 19 years quietly absorbing the cost of an understaffed, under-designed night shift, and I had told myself that was just the job. It wasn't. It was a choice I kept making, and I finally made a different one. The work itself, taking care of people at their worst, in the middle of the night when everything is fragile, that I don't regret for a single hour. That work mattered. It still matters. What I regret is the years I spent believing that doing it without complaint was a virtue instead of a habit I'd mistaken for one. If I'd started keeping better records at year 5 instead of year 19, I don't know that the outcome would have been different. Maybe nothing would have changed at Hargrove until it was ready to change. But I would have had an honest picture of what I was doing, and that picture would have made it harder to convince myself that quiet endurance was the same as being valued. It isn't. It never was. And the sooner you know the difference, the less time you spend waiting for someone else to figure out what you're worth.